Welcome to InfoSource, a presentation of Berkshire Healthcare Systems, a not-for-profit system of post-acute healthcare services, including long-term care, short-term rehabilitation, independent living, assisted living, memory care programs, and hospice services available to our neighbors and families here in the Berkshires and beyond. I'm your host, Rachel Colasino, and today our conversation centers around a new clinical capability available in Western Massachusetts called Transcatheter Aortic Valve Replacement, or TAVR. My guest for today's show is Terry Stimpson, nurse practitioner for Bay State Medical Center's Heart and Vascular Program. She will help us understand this new procedure. Welcome, Terry.
Hi, good afternoon.
Thank you for being here.
Thank you for having me.
So we're going to again discuss this new clinical capability called Transcatheter Aortic Valve Replacement, or TAVR. And Terry is going to help us understand about this surgery and its importance and its benefits for patients in our area. So Terry, let's start with the basics. What is TAVR?
TAVR, or Transcatheter Aortic Valve Replacement, is a surgical procedure that is an option for patients who have degenerative aortic valve disease, which is otherwise called aortic stenosis. And this is a procedure that's a collaborative procedure that is used by cardiac surgeons and interventional cardiologists to help to relieve symptoms of aortic stenosis for patients who suffer from aortic disease.
What would some of those symptoms be? I'm assuming shortness of breath.
Yes, aortic stenosis usually develops in patients as they age, and often over the age of 60, you can start to develop calcium deposits in your aortic valve in your heart, which then make the valve very stiff, and it makes it very difficult for the blood to flow through. So what happens is then people become very symptomatic. Those symptoms could be what we call congestive heart failure, where fluid accumulates around the lungs, and it can make you very short of breath. You can become very fatigued. You may have some swelling in your ankles, and some people, depending on how severe the stenosis is, they can actually pass out, or what we call syncope, where they may try to exert themselves too fast and then therefore pass out because there's not enough blood that's able to get through the valve.
So it's serious.
Yes.
Yeah. So can you give us a description of TAVR, what the surgery looks like?
Sure. So for aortic valve replacements or aortic stenosis, the primary surgery is open heart surgery. However, as we are living longer and people are getting older, we're seeing more patients with aortic stenosis. Not everyone is a candidate for open heart surgery. That may be because of their advanced age as people are living longer. It may be because of their comorbidities, and they have a lot of other health issues that make the risk of cardiac surgery too high. Or there may be patients who are eligible for cardiac surgery, but again, they're very high-risk patients. So if you're having symptoms, and you would ideally be followed by a cardiologist, and if you are they would try to treat you with some medications first to relieve your symptoms. If your symptoms were not being relieved by medications that your physician has prescribed to you, and you meet the criteria for valve replacement, they may have you go and they will have you consult with a cardiac surgeon. And so the cardiac surgeons would see whether or not you would be a candidate for open heart surgery, and if you were either high risk or not an operable candidate, then they may refer you to the TAVR team. The TAVR team includes interventional cardiologists and cardiac surgeons, and they would look at you as a whole and all of your information, and if you were deemed appropriate, they would then proceed with doing this procedure. This procedure differs from cardiac surgery as it is the approach. So instead of having open heart surgery where they would do a sternotomy, where they basically would open up your entire chest to expose the heart. This is more of an interventional procedure, which they go through your groin is one approach. Then they are able to pass a catheter up through your groin into your heart. And the way that they see this is through an x-ray, which is called fluoroscopy. There's actually some radiation involved in this. And they will view the heart and the vessels and the catheter. And what they're able to do is feed this catheter up through your heart into the heart valves and deploy this heart valve, which is attached to a stent, very similar to angioplasty. A lot of people are familiar with having to, if you have a blockage in your heart, then they're able to go up and take a balloon and kind of blow the plaque to the walls and deploy a stent to open up your coronary arteries for blood flow. It's very similar to that, but this is actually a valve instead of a stent to open up blood flow.
And I think you have a picture here that...
I do. This is a picture of what the valve itself looks like. These particular valves are tissue valves, which are made from pig valves and pig tissue. You can see around it there is a metal stent around it, and that actually is what helps to hold it in place around your native valve, your original valve.
And how big is that?
It's not very big. You can see they are 24 millimeters or 26 millimeters around.
Okay. So it sounds like if we're thinking about what open heart surgery looks like or what TAVR looks like, that open heart surgery is much more invasive.
Yes, it is. It is the preferred method if you are a candidate for having your valve replaced by open heart surgery. It allows the surgeons to actually see the heart. But it is extensive. It requires you to have a large incision. It requires them to put you on a heart-lung machine, which is called a cardiopulmonary bypass machine. And so that actually takes over the workload of the heart and stops the heart so that the heart is very still, and then the surgeons are able to see the valve and open the heart. So the recovery is a little bit more extensive, where the TAVR procedure is an incision in the groin where they can access the vessels, and there is another procedure for the TAVR where they do an approach which is called transapical approach, and that is where they do an incision in between the ribs and access the heart valve from that approach.
What is the aortic valve? I'm not a clinician, and I would assume a lot of our audience isn't either. So what is the aortic valve and what does it do?
Sure. You have 4 valves in your heart, and the valves open and close with the contractions of your heart. And the aortic valve in particular, that helps to control the blood flow, oxygenated blood from the ventricle of your heart, and pushes it out into the body and pushes all the oxygenated blood out into the body to feed your head and the rest of your body and organs. And so what happens in aortic stenosis, as that valve gets tighter and tighter, it makes it very hard to push blood through, and so that's where that blood kind of backs up and causes all this congestion. But I do have, again, a picture that you can kind of see that there is 4 valves. And there is, right here is where the aortic valve is, and this helps to push blood out into the rest of your body and your organs.
Okay, thank you. So from Bay State's perspective, what would a successful TAVR surgery look like?
Sure. From Bay State's perspective, a successful TAVR would be one that helps to relieve symptoms. Ideally, this procedure is not going to necessarily, it is going to potentially prolong your life, but the primary goal is to relieve you of the symptoms. Patients who have severe or critical aortic stenosis have a 1 to 2 year mortality rate once they are and have severe symptoms that are not controlled. So this will extend your life, and ideally the goal is to relieve your symptoms. So if that may mean different things to different people. If you came into the office in a wheelchair, it doesn't necessarily mean you're going to leave the hospital and be able to get up and, walk a mile. But it may mean that you may be able to get up and walk yourself to the bathroom. It may mean that you sitting at rest are not short of breath and just feeling very fatigued. So it depends on where you are at baseline. Will depend. So for us, when we see patients 30 days afterwards, if you come in and tell me that you're less fatigued, that you're not feeling short of breath, that you're not passing out when you get up to go do something, and that is success.
Okay. And I understand that Bay State is one of the few hospitals that performs this type of surgery, so can you walk us through the history?
Sure. Yes. So in Massachusetts, right now, we're one of 3 hospitals in Massachusetts who are able to perform this surgery. The other 2 hospitals are in Central Mass. It's Massachusetts General Hospital and the Brigham and Women's Hospital. And so what happened was Edwards is the company that makes this valve, and what they were doing is they were looking for several things. One, they were looking for where the need was, and there was no one in Western Mass who was able to perform these procedures, and they were looking at facilities that had physicians who were competent in certain procedures and who had good outcomes. So they looked at Bay State because, one, we had just opened up a new building and had a new operating room it's a hybrid operating room. And what that is, it's an operating room that allows you to do interventional procedures under this X-ray machine that I was telling you about, but it also allows you to convert it to a traditional operating room without having to move the patient from one room to another, even from one building to another. So the operating room in itself has a lot of capabilities that they were looking for. In addition to that, they were looking for specific again, physicians who are able to do specific things. So for our interventional cardiologists, we have 2 who are trained in this procedure, and that would be Dr. Islam and Dr. Jolson. And they both have successful outcomes in doing a number of procedures called valvuloplasty, where they actually just open up the valve with just a balloon but don't replace the actual valve itself. And then they looked for cardiac surgeons who have done a number of aortic valve replacements and have done them successfully and have had good outcomes. So we had all the things that Edwards was looking for, and so they had approached our surgeons and interventional cardiologists and had asked them if they would be interested in being a designated program.
And that was about a year ago?
Yes.
Okay.
Yes.
So if I were to have this surgery, what could I expect when the surgery is complete? How long would I be in the hospital, for example?
Sure. So that really depends upon what your comorbidities are, what you come into the surgery with. However, the average length of stay is 5 days for this procedure. But again, that would depend on what else was going on. These patients are actually very sick coming in. Sometimes they may be in the hospital for a day or 2 before the surgery to just kind of get tuned up a little bit, as we say, before having the procedure. And But typically it would be 5 days on average. Some patients may have to have anticoagulation, which is a blood thinner. If they have a complication of, say, aortic or atrial fibrillation, they may have to stay in the hospital a little bit longer. So it would kind of depend on what you came in with.
Okay. Thank you, Terry. So we're going to take a quick break, and when we come back, we're going to continue our conversation with Terry, and we're also going to speak with Michelle Wuest, who's an administrator at Williamstown Commons and an occupational therapist herself. So we're going to pick up the conversation with cardiac rehab therapy. We'll be right back for a little bit more information about Williamstown Commons.
In the heart of beautiful and culturally rich Williamstown, Massachusetts, near Williams College and the world-renowned Sterling and Francine Clark Art Institute, Williamstown Commons offers you the best of both worlds. It's a locally run facility staffed by dedicated healthcare professionals from the northern Berkshire area, and it's backed by the expertise and resources of Berkshire Healthcare, the largest nonprofit long-term care provider in Massachusetts. Berkshire Healthcare is committed to fulfilling the health and residential needs of the people in the communities we serve. Williamstown Commons is a proud recipient of the American Healthcare Association's National Quality Award. The Quality Awards recognize members' commitment to performance excellence by continuously demonstrating ever-improving value to residents and other customers. The Bronze, Silver, and Gold Awards recognize overall organizational effectiveness and capabilities and champion organizational and personal learning. At Williamstown Commons, we pride ourselves on our deep commitment to our community. We offer a broad range of nursing home services, including short-term rehabilitation, skilled nursing, long-term care, hospice, and respite care services. We also offer a fully dedicated Alzheimer's unit, providing individualized care, maintaining dignity and the highest quality of life for these residents. We proudly offer a home-like setting that allows our residents the comforts they expect while providing the care they need, including fine dining in our graciously appointed dining room, beautiful outdoor space, ample activities, and private family space. At the heart of it all is a focus on the body, mind, and spirit. Our rehab services include physical, occupational, and speech therapy. Our licensed therapy professionals help restore and maintain the body by focusing on helping our residents improve strength and mobility in order to participate in the activities they most enjoy. These services are provided up to 7 days a week when ordered by a physician. Williamstown Commons is more than a place to live. It's a place to enjoy each day to the fullest. Our activities program focuses on the mind and spirit of our residents by offering engaging leisure and recreational activities, arts and crafts, music, discussion groups, exercise sessions, religious services, and cultural community outings, and more. Each resident and patient at Williamstown Commons receives the highest quality care delivered by our dedicated staff members working as a team. From the nursing staff to our front office personnel, everyone is enthusiastic about the role he or she plays in the lives of the people who entrust us with their care. Our staff is committed to providing compassionate care, using teamwork as their guiding principle. We're dedicated to treating each person with dignity, recognizing their individual needs, goals, and preferences. We create a care plan for each person, focused on helping them achieve the highest level of independence and quality of life. At Williamstown Commons, we're perfecting the art of superior care. If you or a loved one needs short-term rehab, extra care after a hospital stay, or a nursing supervised full-time living arrangement, we invite you to tour and meet our staff. See firsthand how we enhance the lives of those we serve. To make arrangements or get more information, call 413-458-2111. We look forward to meeting you.
Welcome back. We are here with Michelle Wuest, who's the administrator at Williamstown Commons and an occupational therapist herself, as well as Terry Stimson, who's a nurse practitioner at Bay State Medical Center's Heart and Vascular Program. Welcome, Michelle. Welcome back, Terry.
Thank you.
And we've been discussing a new and unique surgery available here in Western Massachusetts called Transcatheter Aortic Valve Replacement. And right before the break, we were talking about what the surgery looks like and what it looks like after. So I was hoping to pick up a conversation with you, Michelle, to talk about cardiac rehab therapy. So let's start at Williamstown Commons. What rehab capabilities do you have?
Well, Williamstown Commons is a 177-bed facility, and we have a mixture of short-term rehab and long-term care. We actually have a really extensive interdisciplinary team that provides great service following any kind of surgery and also cardiac surgery. I have a full team of physical therapists, occupational therapists, and speech therapists. We have a full-time dietitian on our team. I have a full-time nurse practitioner in the facility. My medical director is there 4 days a week on site. I have a social services team, an activities department, and an extensive nursing management team, which also includes a wound care nurse. So we have the capability to provide extensive rehab in that facility.
And when patients come to you, what is the procedure of doing an assessment and seeing what kind of services they need?
Well, when a patient gets admitted to us, one of the first things we do is a comprehensive nursing assessment. So the nursing department will go in, assess the resident, assess their immediate needs, their pain level, their the medications they take. They look at all their other diagnoses and how that affects this cardiac surgery that they may have just had. And once they've completed that, the rehab department will go in and assess that resident, assess that patient, ensure that we determine what their current level of function is, look at what their previous level of function is, and determine what the best course of action and what goals they need to develop for that patient so we can get them out of there as quickly as possible.
So if a patient were to undergo the transcatheter aortic valve replacement, what would their cardiac rehab be like?
Well, one of the things that we would be doing is, as Terry mentioned earlier, there's going to be an incision site, so the nursing department are going to be closely monitoring that incision site. We may ask our wound certified nurse to take a look at that. We would monitor for pain management to ensure that we were providing appropriate pain management. The dietitian would be assessing the resident to make sure that they had the nutritional status that they needed in order to have a complete recovery. The rehab department would be in assessing that resident and doing some strength training, doing activity tolerance training. There's modified Borg test that they may do, which measures cardiopulmonary functioning. They may do, there's a 6-minute walk test, which will assess their activity tolerance and endurance. We would be educating the patient on what not to do and what things they can do with their limitations following that surgery. And they would be working all together as an interdisciplinary team to ensure that that patient has the best rehab that they can and ensure that they have all the education they need before they return back to their home, to their prior level of functioning.
And Terry, what would Bay State Heart and Vascular Program recommend in terms of rehab following the TAVR surgery?
Like Michelle said, it really is geared towards the patient and what their individual needs are. Some patients will only need some will need as short as a week, some may be as long as a month, and to get them back to their baseline, we want to make sure that people are safe at home and able to at least be back to their baseline where they can do activities for themselves and take care of themselves. So it really depends upon the patient and how they come to us and to get them back to their baseline.
And probably what their home situation is like.
Correct.
Too. Okay.
Yes.
So Michelle, if someone is planning to have this type of surgery, what would you recommend in terms of rehab therapy?
I think it's very important that if you're having an elective surgery, that you're actually taking the time to visit rehabilitation facilities to ensure that they have the services that you need. Do they have 6 and 7 day a week of therapy coverage to meet their needs? Is there medical coverage in the building so that there are on-site nurse practitioners or physicians that can actually monitor you while you're in the facility? Do they have availability for you? I mean, one of the things that you have to take into account is if you're not planning it ahead of time, you can't assume that they have a bed available. So you really want to take a look. You want to meet the staff that will be taking care of you and perhaps meet the rehab team. But it's very important to go visit those facilities first before you make a decision.
And how soon before your surgery should you be making those arrangements?
You can make them at any time. We've had calls as little as a few days before to weeks ahead of time. So it's really keep us informed, when's the surgery going to happen, especially if someone lets us know we are going to choose, I'm going to choose Williamstown Commons for therapy. We will plan in advance to have that patient come to us, so we'll save them a bed. If we don't know, we can't do that. So.
Okay. That's great. Well, thank you both for being here. And this has been InfoSource, a presentation of Berkshire Health Systems.